Welcome to Maryland Medicine Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, a new study reveals how risky it is for preteen girls to become pregnant, and student researchers get a chance to show their stuff during Medical Student Research Day. But first, Dean Gladwin is on the move, speaking at Mini Med School and attending the launch of the Institute for Health Computing. Under construction in Montgomery County, the Institute will focus on artificial intelligence and advanced computing to facilitate precision medicine and improve healthcare outcomes.
Really using the revolution in artificial intelligence, in machine learning, to look at data from 2 million patients across the state. How do we find people with early kidney disease, hypertension during pregnancy, early diabetes, poorly controlled diabetes? How do we then reach out and improve care delivery?
The new institute will be located in North Bethesda under the combined leadership of the University of Maryland, Baltimore and the University of Maryland College Park, in collaboration with the University of Maryland Medical System.
Our Empower partnership, our two universities are in the top 10 of public universities in this nation in research funding. That's pretty significant.
This institute will be able to make discoveries that vastly improve our abilities to diagnose, prevent, and treat disease.
In the very near future, the nation will describe Montgomery County as the Silicon Valley of healthcare computing.
The Institute will open in early 2023, and the official lab and office space will open in 2028. A new study co-led by School of Medicine researchers reveals how dangerous it can be for girls under the age of 13 to become pregnant. Published in the Journal of the American Medical Association, the study looked at more than 90,000 delivery records for pregnant preteens.
These girls face uniquely elevated risks if they go on to deliver, even compared to just slightly older teenagers. They have a higher risk of preterm delivery, a higher risk of delivery ending in cesarean section, and in fact more than 3 times the risk of being admitted to the intensive care unit.
The findings take on particular relevance in the wake of the Supreme Court's decision to overturn Roe v. Wade in June.
Data is information and information is power. We need to understand what are the risks faced by these very youngest girls in order to help guide their care and for them to make decisions for something that potentially could affect the rest of their lives.
Dr. Goodman says the study will help to improve efforts to prevent teen and preteen pregnancies. The 45th Annual Medical Student Research Day gave students a chance to share what they've learned from the research projects they conducted with faculty, mentors, and peers.
Our hypothesis was that Black women receiving proton therapy will have a higher incidence of cardiovascular events and risk factors both before and after therapy. And so if our hypothesis is proven correct, the importance of improving accessibility to proton therapy for Black patients would be greatly accentuated.
They build their CVs as well when they do this kind of presentation, because a peer-level conference presentation matters, and that's something that they can add in their CVs.
Presentations range from basic science to translational research projects to projects involving new technology and artificial intelligence. The day-long event featured inspirational speakers, including Dean Gladwin.
I think if you commit to being a physician scientist, you're really committing to be a critical thinker, to think about discovery, to try to answer questions, to stay relevant and cutting edge.
Most of the student presenters won competitive research awards to support their projects. The latest medical research was also featured in this year's edition of Mini Med School.
It recommends eating fish, if you can eat fish at least 2 times per week, or 8 ounces or more per week.
A series of 5 free classes designed to help Baltimore residents improve their health and well-being. Students graduated after learning about everything from infectious diseases like COVID-19 to nutrition and weight management. Dean Gladwin spoke about generational challenges like sickle cell anemia.
When a sickle cell patient tells them about their sickle cell, some doctors don't want to listen.
Yeah, I mean, sickle cell patients have had the worst challenge, because that is very common. 1 out of 500 African Americans will have sickle cell disease, and 8% of you have the trait, have one copy of the gene. And it's a disease that's starting at 6 months of life, you have horrible pain. And when a child has pain, they can't adapt, they can't cope.
Addiction is another generational challenge.
And there's data that less than 10% of people can quit opioids or quit nicotine. So I think we need a focus on addiction and not a police war on drugs. We need a science war on addiction.
Dr. Gladwin says winning the war on addiction will take a greater investment in neuroscience and education and prevention. And that's Frontline News. I'm Larry Roberts. Until next time, have a happy Thanksgiving.